All right. So I was invited to speak about the diet and lifestyle chapter, and I was also asked just to speak a little bit about my experience as somebody who has PKD and who has gone through kidney failure. I had a kidney transplant right before the pandemic, so while everyone was scrambling, trying to get big jars of hand sanitizer and face mask, I was like, I'm good, I already have all of that. It was a really humbling experience for me to go through all of that, because one of the reasons why I became a dietitian was I saw my family members going through kidney failure. We have the more rapidly progressing form, and I thought, all right, I'm gonna take care of myself and it's not gonna happen to me. And as I saw my values going down, I thought, that's somebody else, that's not me. But of course, I had the experience and I made it through. And that was a piece that was really profound in terms of shaping my concept of how diet and nutrition can really impact people. Because I remember lamenting to one of my doctors and saying, it didn't work. I took care of myself and it didn't work. And he said, Kelly, you worked up until the day you had a kidney transplant. You felt healthy and you walked out of the hospital 2 days later, and your kidney function has been great ever since. So I had the transplant in 2019. My GFR is between 90 and 100. My creatinine is between 0.7 and 0.8, and I feel like I always have to knock on wood when I say that, but I'm trying to take good care of myself, and when I work with people around kidney disease, I always try to remind them that we need to expand what that beneficial endpoint might be. So if we can't control going into kidney failure, hopefully we can have some influence over how healthy you are during the process and afterwards. And I know I'm seeing so many nodding heads. I know you all understand that as clinicians. And I'm sure nobody in this room has ever said anything like this, but I have had clients who have said, my doctor told me it doesn't matter what I eat. And so I want to say, just with my patient hat on, or also my dietitian hat on, that what you say and the attitudes you have about diet and lifestyle makes such a huge impression on your patients. So if you're dismissive at all, or, oh, I don't think it's going to do anything, they're probably going to dismiss that in their lives as well. And so that would be my reflections just on my personal experience, and also as a dietitian, as I will more succinctly go over the rest of this presentation. But I just wanted to start with that, just in terms of the perspective that I have. It's just a very personal experience for me around this condition. So I helped out with the CKD guideline, which has been sent to publication. And so I wasn't involved in this guideline, but I have read most of it. I was trying to keep my elbows in, even on the airplane, reading more of it, the pieces that I skimmed through. And I think it's an excellent document, and I'm so happy to see a whole chapter on lifestyle and also psychosocial aspects. So I have a strong interest in integrative approaches and thinking of things from a mind-body perspective. So I really see this as an opportunity, this chapter, to take a look at that holistic approach and also that multidisciplinary approach, which I think is so important. And I think that as we look at an image like this, which you probably won't be able to really see it on the screen here, but if you look at it in the publication, one of the major take-home aspects of this is to help facilitate forming an interdisciplinary team, and trying to do that early on, because people might look healthy and fine, and it's not until you really dig into what they're actually doing, how they're eating, being specific about how much fluid they're taking in or how much salt that they're eating, that if you're not doing that as a physician, there are other support people who can do that for you. And so many patients are very highly motivated and want this information. For the people who aren't as motivated, that's where it comes back to your presentation of how important you think that this might be. So encouraging that team building really early on, And that could be, you know, mental health care, it can be nutrition support, and, you know, it could be people who help out with physical training. It could be the pharmacist. It could be a variety of different healthcare providers. And when people really need their care team and to lean into it the most, that's the most challenging time for them to try to build it. So building it early, I think, is really important. I know you had brought that up as well, knowing that it's important to do that. And the hope is that we can slow the progression, perhaps in some genetic variations more than others, that we can help prevent some of the side effects, those extrarenal manifestations and blood pressure issues and blood sugar issues and those kind of things that can happen with PKD. And just improve quality of life, even reducing pain. There's so much I can say about this slide. I have been trying to think about how I want to sum this up, because in this guideline, there is a reference to the CKD guideline. And in terms of the comments that we got before the publication and the discussions that were happening around tables, there was a lot of discussion. There was a lot of feedback. And so when we're looking at the global recommendations for nutrition, it's really hard to identify one specific dietary pattern that we could recommend, other than the global guidelines from the World Health Organization or some of the other dietary patterns like a Mediterranean diet, like a DASH diet. These have lots of research behind them in terms of the health benefits systemically, and also potentially some benefits for the kidneys as well when we look at the impact of reducing side effects like blood pressure or blood sugar or things like that. There's also quite a lot of discussion that we had, and I'm really glad we have a nice section in the CKD guideline around ultra-processed foods. And I was, as I mentioned, thrilled to see this in there. A lot of people are confused about what's a processed food versus an ultra-processed food. And so an ultra-processed food is basically something that none of our ancestors would ever recognize as food. And you would literally have to look at the front of the label to even know what it was. Because if you read the ingredients, you would have no idea. And this makes up quite a large proportion of people's diets. Some people refer to them as food-like substances, and they really have so little nutritional value. They're missing nutrients. They are inflammatory. We know that there is an inflammatory component to ADPKD. They have excessive salt and sugar in them. When it comes to people who have more advanced disease, they have additives of phosphates and potassium additives, which are more absorbable than what we find in foods. They also are addictive. So the food industry makes sure that they can engineer the sugar, salt, and fat so that it completely overrides our satiety factors. And so we can't stop eating them. And that can lead to people eating more than they need and weight gain and some of those other issues that can happen when people gain more weight than is healthy for them. That affects their kidneys. So most people in here, I'm also seeing nodding heads, knowing that ultra-processed foods are not great. But we do have more evidence now than the previous publications that these are truly not good for the kidneys or the body systemically. So that, I think, is a really strong message that needs to be passed on to patients, and that's reflected in the guidelines. There are also some emerging dietary patterns that many patients are really excited about, and there's some really promising animal research talking about things like ketogenic diets, also very low protein diets and the use of keto acid supplements, even supplementing with things like beta hydroxybutyrate or other keto acids, doing time-restricted fasting or time-restricted eating. And I think it's a controversial, it's somewhat controversial because there's so much demand and interest in the patient population, and we have a lack of really solid data in terms of safety. And some of the studies show that there are minimal safety effects. The animal studies look really promising, which is exciting. But some of the things that could be harmful, especially if we're looking at, say, a ketogenic diet, would be cardiovascular disease. Definitely see people who have elevated blood lipids when they follow this dietary pattern. We also see that there can be an increased risk of kidney stones, uric acid. People sometimes will eat more protein than they are than would be recommended, which could increase the renal acid load and not be good for the kidneys. So even in, I mean, there's only a couple of studies that have looked at these dietary patterns in humans, and the largest one had a little over, I think it had 160 people in it, and over half of them were not able to sustain the diet, even though they self-selected to do this dietary pattern. And so that's another aspect, is it's very challenging for people. So I think there's probably more I could say on it, but I want to be succinct. I think if we're sticking with the guideline, there's not enough evidence to say that this is something that we would recommend. However, if somebody really is pressing and wanting to do it, I would recommend that you refer them to a dietitian who knows how to work with these types of dietary patterns so that they're doing it in the safest way possible. And also monitor their labs to make sure that they're not having any negative effects. If we look at some of the specific nutrients, we know that water, salt, these are not something that are unknown to all of you. I would say water is probably a special feature for ADPKD, and it's already been mentioned that we want to try to promote intake to at least 2 liters per day. If someone's a stone former, maybe 2.5 liters. For the salt, less than 2 grams, 5 grams of sodium or salt, that would be like about a teaspoon of salt. And these are 2 that I think could warrant a little extra investigation for people, because many people that I work with are surprised at how much salt they're actually taking in, and they're also not really thinking that much about how much fluid they're taking in. And sometimes it feels very, very basic to be working with someone on getting more fluid in, but dietitians have the time to do that, and so it can be really helpful to show people exactly what that means to eat in this way. Protein was another one that there was a lot of discussion about, and there are multiple working groups that found that the World Health Organization was really the most evidence-based recommendation that we could make right now in terms of amount of protein. So about 0.8 or 0.8 to 1 is what most of the working groups have seemed to have landed on. There's some discussion around the types of proteins. So in our CKD publication, we have some information about plant-based diets being perhaps more anti-inflammatory and helpful, so encouraging people to eat whole foods, plant-based diets seems to be prudent. And when it comes to excessive protein intake, so thinking about once we get into grams and such, it's sometimes helpful to think about referring to a dietitian, but above 1.3 grams per kilogram if people are quantifying what they're eating. And then if someone is malnourished, we would actually we would probably look at 1 or 1.2 or a little bit higher. We'd kind of take it individually. But if someone does have malnutrition, we'd want to not restrict their protein too severely. We also included in our guideline some information about, as a practice point, about the use of very low protein diets and keto acids. And what we found was that there wasn't a lot of evidence for benefit between 0.6 and 0.8 other than just following 0.8 grams per kilogram. But for people with G4, G5, that there does seem to be some benefit for very low protein diets, maybe looking at 0.3 grams per kilogram, and then supplementing with keto acids up until about 0.6. And so keto acids are special amino acids where they don't actually have nitrogen, but they can participate in transamination. So they're not available everywhere around the world. They're also expensive and people have to pay out of pocket. So this is something where there needs to be a discussion, shared decision making around this. And our recommendation as a practice point, or our practice point stated, that it would be more beneficial or would be appropriate for people who are highly motivated and who have the resources to try this, although we need more research. That was one of the recommendations as well, that we need more research on those very low protein diets. Calories, we want to make sure that people are not exceeding the calories that are like basically that they're eating enough for themselves and not exceeding. And then also with fat, thinking of the fat quality and quantity. When it comes to saturated fats, I often think about that in terms of a dietary pattern. So if people are eating less processed food, less animal proteins, they're naturally going to have less saturated fat, unless they really love coconut oil and they're really eating a lot of that. Then they're probably going to be low in saturated fats. And then caffeine is another one that could potentially increase blood pressure. It's part of international recommendations, around 400 milligrams or less. The other things that we can think about when we're looking at the guideline here for the practice points, working with accredited nutritional professionals. So there might not be a dietitian in every country or every city around the world, but trying to find people that do have experience with renal nutrition and who have some sort of accreditation. There's a practice point about body weight and using BMI. We have a description around sort of the imperfection of the BMI in the CKD guideline because it does have some flaws in terms of its cultural inclusivity. And so we need to use that as one data point when we're assessing somebody's weight and what their typical weight is, how much weight they might have gained, other metabolic parameters to really try to identify what's truly a healthy weight for somebody. There are standards that are set by the World Health Organization and other international organizations. And also I would recommend utilizing this more expanded approach when we're trying to identify what a healthy body weight is for somebody. We also need to make sure that we're evaluating people who are in later stages or at any point along the way. Someone might be at an early stage CKD but have advanced liver disease, so evaluating for malnutrition. Physical activity is kind of the panacea. I really think that it can really help with so many different things. So definitely, cardiometabolic risk factors, weight, muscle mass, stress, mental health, gut health, bone health. Whenever people come to me and they're like, I just want to feel better, what can I do? I always say, well, let's start with physical activity because it truly can help almost everything. And it can make people stronger, especially if they're going to be facing surgery, finding a way that they can do that that's not going to injure them. Some of the practice points in the document talk about people who might have really large kidneys or liver, making sure that they're not doing contact sports, making sure that they might work with a physical trainer if they are in pain so that they're not being physically active because they're in pain, to try to help with that. There's also a practice point about, these are obvious. I probably don't need to say anything about tobacco and alcohol, although there's probably mixed opinions about alcohol, but I usually don't recommend people start drinking alcohol. But if they are having alcohol to, I'm actually helping out with a study right now where we're doing Mediterranean diet tracking, and there you get a point if you drink wine, and I always think that's a little strange and maybe not applicable for all situations. But just being really cautious, knowing that it is a toxin. Cannabis is really common now, so that's included. I'm glad to see that included here. There are some dangers with some of the contaminants that might happen if people are buying it off the street or something like that, or synthetic versions. There are also, clearly like drugs and such, which are not good for the kidney. One thing I will say about cannabis or CBD that a lot of people are taking now is that it's a really potent CYP3A4 inhibitor. So if people are on medications that are reliant on that enzyme, it can inhibit it. And like, for instance, immunosuppressive medications, it can really make them go high. So it's important to know, and that's actually kind of a funny joke if you think about it. It makes them go high. So anyway, being careful about cannabis and asking people about that. Just a couple more points here. So making sure, like with the psychosocial care, doing regular screening, that oftentimes people will present and say, I'm fine. I think that's a major takeaway, is that we want to make sure that we're screening people and also caregivers for some of the psychosocial impacts that are happening. So those are some practice points here, using shared decision-making and also helping people to access those holistic care pathways. I promise just a couple more slides. When we're looking at encouraging people to participate in clinical trials, talking to people about genetic testing, the pros and cons, and then, again, just helping with coordination of patient care around all of the different aspects of PKD management. And some of these are kind of similar around, accessing care. However, I think this slide is really important to consider cultural norms and practices, especially around diet, around communication styles, to make sure that that is being considered in terms of communication and care. So take-home messages, multidisciplinary care team, starting that early is important so that people have relationships as they're going through this process, and then really encouraging those healthy dietary and lifestyle habits so that your patients will have that sense of thinking it's important too if they're not already motivated. All right, thanks.